Hello, everyone, and welcome to our latest WADEM COVID-19 podcast. My name's Joe Cuthbertson. I'm from WADEM Oceania, and today I'm speaking with Associate Professor Erin Smith, who's the course coordinator at the School of Medical and Health Sciences at Edith Cowan University. How are you, Erin?
I'm very well, Joe. How are you?
Yes, I'm great, thanks. Thanks for taking the time to speak with us today. This is an exciting podcast. This is some research that's recently been done in Australia, particularly, well, in fact, why don't you tell us a little bit about the focus of your research, Erin, and why you chose to investigate that area?
Sure. Well, I guess probably dating back to nearly the start of the pandemic here in Australia, we were already hearing reports, and I know this has happened globally as well. We were hearing reports from those on the front line, so particularly our doctors and nurses, that there were real concerns about working during the COVID-19 pandemic. And a lot of those concerns really seemed to focus on access or lack of access of that personal protective equipment or PPE. And the more that I was doing interviews and being engaged in the media and writing about these issues, the more these healthcare workers were actually reaching out to me to tell me their anecdotal stories. And what was very interesting, but also quite upsetting at the same time, was to hear that a lot of these healthcare workers had essentially been gagged by their employers and told that they weren't allowed to talk about the issues that were occurring in terms of accessing and being asked to ration their use of PPE. And so they were trying to find ways to get those stories out into the public so that everyone would actually know what was happening. And as this continued to sort of escalate, the back of my mind, I'm thinking, it's great to have these anecdotal stories, but we really need more of an objective data set. What is actually happening out there in the hospitals, in the GP clinics, in the pre-hospital environment? So I think this would have to be probably the quickest research project I have ever through to ethics approving the actual survey live within a week. And that's unheard of, particularly, for me. But that's largely due to the amazing collaboration from my collaborating researcher, Dr. Brennen Mills from the School of Medical and Health Sciences at Edith Cowan as well. He's a bit of a guru and expert when it comes to the quantitative side of research, because I must admit qualitative research tends to be more of my bag. So he came on board to really help me develop that survey to get out there quite quickly to really start gauging, well, what was actually happening amongst our frontline healthcare workers in Australia. So we included doctors, nurses and paramedics. And the survey we purposely wanted to be very quick to complete, very easy to complete, and really being able to get out there and snowballing it around social media to try to get as many people involved as we could in a short period of time, because we really wanted to have that contemporary, relevant, current evidence, not having to wait months and months and months for results to be available. So that's sort of the lead into how we came about to do this national survey. And we were absolutely thrilled in the end to have, it was nearly 700 responses, but out of that there were about 580 that met all of the criteria, which meant that we could actually include their responses, and that's what's informed the results of this survey to date.
Fantastic. So is there any other research out there in Australia like this at the moment?
Look, there certainly is, and I know that I myself have been almost bombarded with requests to do surveys, particularly around health and well-being and supporting well-being, and a lot of those surveys were more in-depth. They were using pre-existing validated tools, which means that they will have great findings and a lot stronger recruitment methodologies. We were very aware that this was going to be a quick and dirty survey just to try to get some idea of what was happening at that frontline level, and much more around the concerns about working. So what were the issues with PPE? What were their concerns? Was it impacting on their willingness to work? And to date, this is the first national survey that has really managed to collect that kind of data from a pretty decent sample. So 580 frontline workers across Australia is still pretty great for, we only had the survey live for just over 2 weeks.
Well done. So don't keep us in suspense. What did your results show?
We were actually, we would have liked to have shown that the problems weren't as big as we had heard, but unfortunately they were. So we certainly heard that, yes, there were quite a few frontline healthcare workers that were very concerned about being asked to work during the COVID-19 pandemic. One thing I want to highlight is that overwhelmingly what came through is that, yeah, and we see this globally as well, is that our frontline healthcare workers are very willing to work. They're putting themselves out there, and that's why they do what they do. They are generally, a caring profession. They do what they do because they are empathetic and nurturing, and they want to be able to help. But when you have a situation like this where there are very real risks to their health and safety, at some point there's going to be this ethical dilemma where they have to start weighing up, is my job really worth my own health and particularly the health and well-being of my loved ones? And as you know, Jo, we've certainly seen that this is a very real risk around the world. Globally, we've had thousands of healthcare workers infected with COVID-19 coronavirus, and sadly, we're into the hundreds now of healthcare workers who have sadly died. So that risk is very real. We are very fortunate here in Australia that we haven't been impacted to that degree. We certainly have had healthcare workers exposed, having to quarantine and isolate, but nothing like what we're seeing in other countries like Italy and Spain and the UK and the US, particularly, for example. So we were still really interested to say, okay, well, what's actually happened? What are some of the issues and the concerns? And there were a whole heap of closed questions, and I'll report on some of that data briefly. But for me, being that qualitative researcher who really likes the feelings and the descriptions behind things, it was some of the open-ended question and answer sections that really shone a light on what's happening out there on the front lines. And some of it was really difficult. Like, some were reporting, I haven't been able to hug my family in months, or that their children had been basically removed from the home because they want them to be safe, but they're living in isolation with grandparents, and until very recently they hadn't seen them in quite a long time. So just those kind of family level concerns. And then you add on top of that, again, they're being gagged by employers. There's this real sense of mistrust and anger towards employers that was certainly coming through in a lot of the findings, because they just feel like, hey, we are out there every single day. We can't stay home. We are putting ourselves at risk, and you can't even provide us with the basic PPE to be able to protect ourselves. And even when the PPE is there, we're being asked to ration it and use it in ways that we know isn't really going to protect us the way that we need it to be protecting us. So, I mean, that's some broad level stuff. If you like, I can get into some of the numbers that came out of it.
Sure. Yeah. Tell us what you found.
So overwhelmingly, out of that large group, the majority of respondents were nurses and paramedics, but we did have just under 100 medical doctors, and it was interesting that it was those medical doctors that seemed to have the highest levels of concern, the more reporting of their willingness to work being impacted. So that was interesting. Almost 2/3 of that entire population suggested that they felt it was really likely, or so likely or very likely, that they would contract COVID-19 at work. And what was really concerning was that around half of all of our participants actually said that their actual current access to PPE was inadequate for them to safely perform their job and for them to feel safe turning up to work and protecting the rest of the community. So, yeah, half of those that were surveyed actually said that they don't have enough access to PPE. So that really backed up what we were hearing anecdotally before we actually did the survey. And perhaps not surprisingly, that access to PPE was really creating undue anxiety and stress for about 60% of the participants. So they're pretty decent numbers. We're not talking just, a handful. This was well over half of our participants had all major concerns around access to PPE and the fact that it was then creating this anxiety and stress about doing their job. In terms of the actual PPE that was reported as being the most difficult to get their hands on, it was gowns, face masks and face shields. And what also backed up some of the anecdotal data that we were hearing before we did the survey was that many hospitals and GP clinics had run out of hand sanitizer weeks previously. So they couldn't even have sanitizer to clean their hands, but then they were being asked to ration PPE on top of that. And we had stories of pregnant nurses being instructed not to wear masks and adequate PPE when triaging patients and treating patients. We had other nurses saying that they had been told the same thing, that they had to use the one mask for the entire day, and that some nurses were saying there just was not access to the PPE that they were required to have to adequately protect themselves when they were treating patients. And this was a particular concern, Joe, and something really quite worrying was, it's not just for the confirmed COVID patients. Anyone that came in that was potentially COVID positive but needed to be resuscitated, for example, all of the healthcare workers needed to be donning full PPE. But what happens when that access to that PPE is really difficult to come by? So do you have people not protected doing CPR, or do you have ineffective CPR being done by fewer healthcare workers? So there's this flow-on effect that we probably haven't really considered too much, and it's a few presentations that I've listened to recently have been talking about this, the non-COVID related deaths that will actually flow out of this as well, and particularly that a lot of those reports are coming out of the United States, like how many people have had less than, adequate care because of COVID happening in the background and the lack of PPE happening in the background. So they're just some pretty concerning results off the top of the list there.
Yeah, the PPE shortage and the PPE supply chain is certainly been a global theme and something that's been brought up by other participants in this program. The recommendations related to this research, were there any specific ones that you've developed thus far?
Yeah, that's interesting, Joe. We probably haven't got to the point of listing recommendations. We're still just highlighting what the main issues were, and some of the key issues that certainly came through were this lack of feeling of being safe and protected at work. And again, one of the interesting statistical findings was that only 13% of all of the participants actually said they feel as safe at work now as they did pre-pandemic. So that's a really small number. So obviously the safety concerns need to be addressed, not only now in this pandemic, but that's a key lesson moving forward for other pandemics and other infectious disease outbreaks, is that you need to address this. As an employer of frontline healthcare workers, that needs to be addressed. And what was also of real concern was that nearly half of all those frontline healthcare workers said that they didn't feel like their hospital or employer was actually doing everything that they could to protect their well-being. And that concern actually flowed on to their loved ones as well, with 80% of all of our participants actually reporting a fear of potentially exposing members of their household to the virus. And that was a really interesting finding, and again, something that backed up a lot of the anecdotal reports that we had been hearing, was that yes, they're concerned about themselves, but they're actually more concerned about their loved ones. They'd never experienced anything like this before, in that you could go to work and then bring it home to your loved ones. And we've certainly seen that that has occurred, particularly in the United States. We have seen examples of where a nurse got infected at work and then went home and infected his husband as well. So we've certainly, this isn't a risk that they can take too lightly. And I guess what flowed on from that as well is that we asked them, well, if you are concerned, what are you doing about that? And at least a quarter of all the participants had actually chosen to self-isolate away from their family. And some had gone to the extreme efforts of actually physically removing themselves from the family home. So we didn't actually measure health or well-being, but the impact on well-being from just that alone, from being away from your family members during one of the most stressful events that we've ever lived through here in Australia and globally, what toll that will take. And we have seen here in Australia that many states have started offering free hotel-based accommodation and other options for healthcare workers to self-isolate outside of the home. But before that happened, it was the financial burden as well. We had many nurses and doctors saying, I am not comfortable going home at the end of a shift where I've potentially been exposed, and then I have to live in the same household as my loved ones and potentially expose them. but financially I can't afford to pay to stay outside of the home. So in the earlier days of the pandemic, that was certainly a big concern, and something that employers will need to be mindful of moving forward is that those kind of supportive mechanisms like providing accommodation outside of the family home need to be implemented much more quickly when something like this occurs.
Yeah, there's so many lessons to take away from this event that we're still working through now. Speaking of which, it sort of demonstrates the importance of research in identifying key areas for improvement. Where do you see this in terms of this research project and research in general related to COVID-19 in Australia?
Well, I think there is so much to learn from this, like you've said, Joe, and I think this little survey provides, as I said, it was a very quick and dirty snapshot of what was happening, that cross-sectional perspective of what was happening among this sample of frontline healthcare workers. I mean, firstly, from a researcher perspective, it would be very nice to be able to follow this up and see if these kinds of concerns and issues that are raised are going to change as the pandemic goes on. But it's also giving us the basis for future research as well. So what we found within this study was that 3/4 of all of the frontline healthcare workers actually reported that they had started to weigh up that balance between their professional obligation and their personal risk. And we know that this whole idea of, well, do I have a duty to respond, a duty to work, is something that really needs to be clarified for frontline healthcare workers, particularly within the pre-hospital environment, where clear guidance around their professional responsibility and what their duty to treat is compared to a normal everyday operation when it's becoming a pandemic, that kind of guidance is still really lacking. And we know that our paramedics are still really questioning, well, what is my obligation? And is that obligation a legal one or an ethical one? And where's the guidance on that? And to some extent, doctors and nurses have a little bit more guidance when it comes to codes of ethics and guidelines, but they're still largely up in the dark as well as to what would happen if they actually started to make that decision and say, you know what, it's not worth the risk to myself. We know that one very real outcome will be absenteeism, and how do we fill the gaps within the frontline workforce. So that's certainly an area that we want to dig a little bit deeper in terms of some ongoing research around that. And certainly around the willingness to work aspect, like what actually was enabling people to feel willing to work during the pandemic, and just as important, what was actually inhibiting or making them feel like they didn't want to be willing to work during the pandemic. It's really important to get some more contextual information and from a broader sample, not only in Australia but around the world as well. So lots of interesting stuff that I think will spill out of this post-pandemic in the research space.
That's great, Erin. Really looking forward to hearing more about that in the future, and hopefully you can join us on another podcast to tell us more about that. Really like to thank you again for your time today speaking to us at WADEM and sharing your research outputs. And to everyone out there, stay safe, and I look forward to the next podcast and you tapping in to hear what our next update is. Thanks very much, Erin, and see you later, everyone.